We work to create a world
that's free of infectious diseases.
We work to make sure
that no infectious disease
is left unchallenged.
We discover, develop,
implement and evaluate
health solutions,
working alongside the most at-risk communities.
Doing so ultimately builds
a healthier, safer world for everyone.
We are the Kirby Institute.
Thank you for joining us for our special Kirby Institute event for International Women's Day and International HPV Awareness Day. My name is Vanessa Price. I'm a Senior Program Manager in the Asia and Pacific Health Program at the Kirby Institute. I would like to begin by acknowledging the traditional custodians of the lands from which I am joining today, the Bundjalung people, as well as the traditional custodians of the land on which many at the Kirby Institute are gathering today, and pay my respects to their elders past and present. The Kirby Institute is located on the lands of the Bidjigal people of the Eora Nation. I extend my respect to Aboriginal and Torres Strait Islander peoples joining us today. Some housekeeping to start off with. Format for the webinar will start off with 4 presentations, followed by a Q&A session after. You can ask questions throughout by clicking on the Q&A icon at the bottom of the screen. Our speakers today are joining us from Fiji, Papua New Guinea and Vanuatu, and I happen to be in northern New South Wales where there's currently some wild weather, so please have patience if we have any technical issues. Today's seminar brings together voices from some incredibly impressive, passionate and dedicated women who are working with their communities to increase prevention, screening and treatment for cervical cancer. Rates of cervical cancer in the Pacific are among the highest in the world, according to the World Health Organization, with Pacific women up to 14 times more likely to die from cervical cancer than women in Australia. It's a stark difference. Inspired by this year's International Women's Day theme, March Forward, these inspiring women leaders will share stories about their work and their tireless advocacy to improve health outcomes for women in their countries. Firstly, I would like to introduce Ms. Jossie Gabuzzi. Jossie is a project coordinator for the elimination of cervical cancer in the Western Pacific program in the Western Highlands province of Papua New Guinea. Jossie is from Madang Province in Papua New Guinea and graduated with a bachelor's degree as a health extension officer from Divine Word University. She has worked in the non-profit sector coordinating tuberculosis, malaria and STI HIV projects across Papua New Guinea, including at the Papua New Guinea Institute of Medical Research. She has coordinated cervical cancer research projects from pap smear, cryotherapy, and through to HPV in partnership with the Kirby Institute, and now trains others both across Papua New Guinea and across the Pacific in rolling out these programs. Over to you, Jossie.
Next, please. Western Highlands is one of the 10 cities in Papua New Guinea and is located in the Highlands region. It is a mountainous province with a cold climate and famous for coffee, fresh fruits and vegetables, as shown on the map with the yellow arrow pointing down. It holds an estimated population of 531,400 and covers an area of 4,299 square kilometers. It consists of 4 districts, which are Agen Central, Tambul Nebilia, Mulbaya, and Day Council. Cervical cancer is one of the leading causes of death of women in the Western Highlands province, and about 50% of all gynecological deaths in a year is due to cervical cancer. The Western Highlands program follows the WHO global strategy to accelerate the elimination of cervical cancer by 2030 using a three-pronged approach, which are 90% of girls 9 to 14 years immunized by HPV, 70% of women aged 30 to 59 must be screened by HPV DNA testing, and 90% of women with pre-invasive and invasive disease must be treated. The screening target for elimination of cervical cancer Western Pacific program in Western Highlands is 30,000 women to be screened by the end of 2025. The province is on track to meet that target. Next, please. Western Highlands province works with a hub and spoke model with a central testing site at the Well Women's Clinic on site at Mount Again Provincial Hospital. This clinic was built from renovated shipping containers and has triaging, health education, screening, self-collection, and waiting areas with one gene expert room for testing, one treatment room for thermal ablation, and one treatment room for leads procedure. The spokes of the program represents the rural outreach program, where a purpose-built mobile truck or van is used to take a team of nurses, CHW, data entry clerks, securities, and health promotion officers to communities so women can access the service without needing to travel to Mount Again Provincial Hospital. Next, please. Outreach activities are conducted twice in a month for each of the 4 districts in Western Highlands Province. As you can see, the modified van here, it is modified into a mini clinic which has a genset installed to power the truck. It has a toilet, sink, examination bed and light, cupboards for storing laboratory consumables, and bench for gene expert machines. Awareness on cervical cancer screening is conducted with a collective team effort from Well Women Clinic staff, health promotion officers from the Western Highlands Provincial Health Authority, and village health assistants in the 4 districts of Western Highlands. About 300 to 400 women are screened during each outreach per district. Around 50% of women screened in Western Highlands Province have been through the outreach program. These are some of the photos of our outreach activities being implemented in 2023 and 2024. As you can see in the picture here, there's a lot of women, more than 700 women came on our first outreach to one of the districts in Western Highlands Province, which is Tambul Nebilia, at the health facility called Togoba Health Center. That we had to reschedule the 700 women to 50 to 70 per day for 2 weeks to screen the whole lot of 700 women. We also encountered few challenges during our outreach activities, as shown in the pictures here, like deteriorating road conditions after heavy downpour, and the weather is bad weather, but the team still managed to screen women despite these challenges. There is huge demand for screen and treat program in rural and remote Western Highlands Province. Outreach program has been hugely successful with positive feedback from communities. Women from the community were so privileged and were thrilled by the outreach program that we do bi-monthly. One of the women who was screened and found to be had cervical lesion was referred to gynae team at Mount Again Provincial Hospital, and she had TAH, total abdominal hysterectomy, and now she is the active village health assistant in Again Central District, sharing a testimony and mobilizing women to come to the clinic for screening. Screening from 2022 to 2025, over 23,000 women in Western Highlands Province have presented for screening, with around half of these women screened at our Well Women Clinic in Madang Provincial Hospital, and half have reached through the outreach program, bringing the service to their community, overcoming barriers to them accessing the clinic due to non-availability of the transport, financial issues, physical ability, or child care duties. Out of the 23,000 women screened, 19% were HPV positive, 15% were treated with thermal ablation, and 4% were referred due to other gynae problems, or the SCJ squamous cell junction is not visible, or they're already at advanced cancer. This is the map from the CAN screen. The dark shaded area is showing Western Highlands Province, where women from both the static clinic or the urban clinic and women from the remote or rural areas of Western Highlands were being screened in 2022, 3, 4, and 5. So the focus of Western Highlands Province in 2025 is reaching the remaining approximately 7,000 women yet to be screened. To meet the program's elimination goals, the team are utilizing data captured in CAN screen, as shown in the map, to help target underreached areas and locate women who are yet to access this important service. Some of the highlights, our clinic is the model clinic in Papua New Guinea. We trained staff from other PHs in PNG on cervical cancer screening, like Madang PHA, New Ireland, Southern Islands, staff from Kujip Nazarene Hospital in Jiwaka, and staff from Anglican in POM. We also have Leeds Clinic available in the province, and women from other provinces neighboring Highlands provinces and other provinces like NCD, Madang, Morobe are also accessing our service here in Western Highlands. So this is a picture of nurses and teachers from Eastern Highlands Province, traveled all the way from Eastern Highlands to Mount Hagen Provincial Hospital to access the cervical cancer screening service. I'd like to take this time to thank the organization, donors, and partners who have supported the Western Highlands program to become successful. And they are staff and management of Western Highlands PHA, especially our CEO, Ms. Jane Olin, and Dr. Ripa, Minduru Foundation, PNG Obstetrics and Gynecology Society, Kirby Institute of UNSW, Family Planning Australia, C4, ACPCC, and ECCWP donor and agencies. This brings me to the end of my presentation. Thank you all.
Thank you so much, Jossie. And Jossie really is a driving force behind the program in the Western Highlands. So it's really great to see you presenting on the program here today. Thanks, Jossie. So next up, we have Dr. Margaret Sereri, who is a consultant obstetrician and gynecologist at the Northern Provincial Hospital in Santo, Vanuatu. And she is actually coming to us today from a vessel Helper 1, where she has been conducting outreach today. So thank you, Margaret, for making the time. Margaret graduated from Fiji National University in 2019. She loves working with women, covering preventative and curative health for them and their families. Margaret has worked with the Ministry of Health as program facilitator in addressing and promoting family planning in Vanuatu, for essential early newborn care and gender-based violence, working in collaboration with UNFPA, and facilitator for basic emergency obstetrics and newborn care that supports the implementation of the minimally invasive service package for sexual and reproductive health during an emergency or disaster response and recovery. She is a focal lead for the National Surgical Obstetric and Anaesthesia Plan development for Vanuatu, and also the Vice President of the Vanuatu Family Health Association, a non-government institution that provides reproductive health services to women and youths, and has also been a key partner in the cervical screening program. She is proud to be a part of the Eliminate Cervical Cancer in the Western Pacific program. Thanks, Margaret. Over to you.
Good afternoon, everyone, and I'd like to acknowledge Kirby Institute for invitation to represent Vanuatu on this important occasion as we march forward from promises to progress in terms of addressing challenges and way forward to address cervical cancer in the region. So Vanuatu, as you can see from the map, it's located northwest from Australia, west of Fiji, and south from Solomon Islands. It's an archipelago of 83 volcanic islands. We have 6 provinces with a population just above 300,000 people. 33% of our women are aged 15 and older. We have 22 women diagnosed annually and 19 die from the disease cervical cancer every year. Cervical cancer is the second most frequent cancer among our women in Vanuatu. And from 2000 onwards, we did have a screening program where we did conventional pap smear. And then before that, it was more of opportunistic screening followed by HPV DNA testing from 2015 onwards, with a pilot introduction of HPV vaccination program. That was continued for a few years and then stopped due to funding issues. Next, please. So from then on, there was a lot of consultations and dialogue between Kirby Institute with our local team at Ministry of Health. You know, in Vanuatu, you have to have a political will to drive things forward. So we had the official launching of Vanuatu's commitment to eliminating cervical cancer back in 2023, where we had the Australian government and representative from Kirby Institute and all the donor partners were all in Port Vila for our this important occasion. Next, please. So for our HPV-based cervical screening program for women, according to WHO, we aim to vaccinate 90% of girls, screen at least 70% of women aged 30 to 54, screen for women 30 to 54 years of age in our setting, and we aim to treat 90% of women with early precancerous disease. So our target population for women 30 to 54 years of age nationally is about 26,000 women. And after the launching, even prior the launching, we have established 2 screening hubs in Vanuatu. One in Port Vila, which we started off with our screening in 2022. And then the following year, we moved to Luganville, where I'm based at the moment. We started our screening from March 2023 onwards. And with this program in place, we had a lot of community engagement and mobilization by our team and the NGOs who are part of us, giving more awareness to women out there and the importance of screening for them to come forward. And we've also commenced with our outreach. We wanted to cover all our provinces in Vanuatu. So as you can see from the 2 pictures on the screen, we have these amazing women here and our staff who have worked tirelessly to get this program started and going. Our Villa Central Hospital Hub staff and our Northern Provincial Hospital Hub staff from the picture. So far from 2022 until to date, from our statistics, we've screened a total of 12,470 women with our HPV positivity rate in Vanuatu of 18%. 33% of the positive cases were oncogenic type 16, 18, and 45. And our thermal ablation rates about 63%. And we are still trying to get all those women who are positive with the HPV to come forward for treatment. We're aiming to reach 90% of those people who are positive with HPV virus. Next, please. So with this program, there's a lot of barriers with regards to treatment of HPV positive cases. And we have challenges outlined. Of course, we have limited access to healthcare infrastructures and resources. Our workforce is one of our main challenges, lack of awareness and stigma. This is especially seen in our communities, not only in rural areas, but urban areas as well. We have difficulty in locating HPV positive women, especially to do with communication issues and geographical barriers, and also financial constraints for women to travel forward for treatment. So the following on the right is our strategies that we're working on to try and achieve. Our aim is training and capacity building. So training and capacity building, we are training more of our staff to join our team in terms of doing educational awareness, training them to do testing and treatments, and also follow-ups. Also, one of the strategies is also to invest in healthcare infrastructures, community awareness and engagement, to have more outreaches to our outer islands, and robust monitoring and evaluation of this project going forward. Next, please. So for community engagement, the tools that we use to get more people informed is we used radio and TV talkback shows. We used information sessions with our community leaders and groups, and also distribution of our educational materials. In terms of our outreach, we do very open and inter-island outreach. That has been started from 2023, and it's still going on. Actually, as we speak, we have a team of outreach in outer islands, small islands out from Santo, who are doing outreach at the moment. And also, we have established a support clinics for sample collection. These are the clinics outside from the main hub for them to be able to collect samples and then transfer those samples to the main hub for testing and treatment if they are positive. So as you know, as you've seen from the map at the beginning of my presentation, Vanuatu is a small island nation with 6 provinces, and the challenges of reaching out to these islands is high. So we have come up with these are the mode of transportations that we use for our outreaches. Helper One is the vessel that I'm currently on now, has been very helpful in terms of outreaches to our outer islands, especially the ones that we can't reach with vehicles or boats. So that is the main vessel that we use. We also use transports in inland outreaches. As you can see, there's pictures of staff at the back of the truck with the raincoats, whether it's rainy weather or good weather, the outreach has to go on. And we also use the fiberglass boats for inter-island outreaches, and even the air taxis for outer island outreaches as well. So a few challenges with conducting outreach. We have geographical barriers, difficult to access very remote communities, and even logistics. Vanuatu is, I would say, a disaster-prone country. We had cyclones or earthquake, the recent earthquake that occurred in Port Vila. This has also disrupted our outreach programs, because then the country has to be in emergency mode in order to respond to the disaster, and also disruptions to shipping due to the Air Vanuatu liquidation that happened last year, natural disasters, and also human resource challenges is one of the main factor in terms of conducting outreaches. In order for us to go on, and we appreciate and acknowledge the help from our major donors, Kirby Institute, our government as well. We're putting our hands together to be able to reach our target population out there, and also to ensure that cervical cancer is being eliminated in Vanuatu. So with that, I'd like to wish all the women out there a happy International Women's Day to you all, Women's Health Champions. As I've mentioned earlier, thank you so much to the Kirby Institute, Mindere Foundation, C4, ACPCC, Daffodil Center, Family Planning Australia, EPIC, also Ministry of Health Vanuatu, and Vanuatu Family Health Association for putting our hands together in addressing cervical cancer in the region. Thank you so much.
Thank you so much, Margaret, and a happy International Women's Day to you. I mean, you and the team are the true essence of women's health champions, as you said, often, taking off your everyday hat to then respond to emergencies and then back again. It's really, a real privilege to be a part of and with you all. So moving on now, and moving back to PNG actually, to Dr. Paula Saverio, who is the Specialist Medical Officer in Obstetrics and Gynecology in New Ireland Provincial Health Authority, Papua New Guinea. Paula is the only obstetrician gynecologist working in New Ireland Province with an estimated population of over 230,000 people. She has been working in the Obstetrics and Gynecology Division for 14 years in hospitals across the country. Currently, she is also performing as the Acting Chief Medical Officer for Kavieng Provincial Hospital, wearing many hats as so many do. Paula attained her Bachelor of Medicine and Surgery degree from the University of Papua New Guinea, and also a diploma and master in obstetrics and gynecology. She is a RANSCOG Associate Member and a member of the PNG ONG Society and Pacific Society of Reproductive Health. She feels the biggest achievement of her career to date was advocating towards and leading the establishment of the HPV point-of-care testing and treatment service for New Ireland Province. Over to you, Paula, so you can tell us more about that.
Thank you, Vanessa, for that introduction. Good afternoon, everyone. I am Paula, and I am honored to have been invited by Kirby to share with you how we went about establishing the point-of-care HPV screen and treat service for the elimination of cervical cancer program in New Ireland Province, Papua New Guinea. From the first slide, you can see on your left is a photograph of our clinic, and we have our signboard there. It's called the Lukauti Mary Clinic. And on your left, right, is a photo of the opening of the service, which took place this time in March last year. Next slide, please. So by way of introduction, as my colleague Josephine from Western Highlands Province has mentioned, cervical cancer is the second leading female cancer in this country and cause for premature deaths amongst women in Papua New Guinea, second to breast cancer. In New Ireland Province, it is the leading cause of admissions, accounting for 1 in every 5 admissions to our gynecology ward. The WHO in 2021 recognized and established that the HPV screen and treat was the accepted strategy for cervical screening and cancer prevention in low to middle income countries. And in the same year, the PNG National Technical Working Group on Cervical Cancer recommended the introduction and scale up of HPV screen and treat program in all our provincial health authorities. In March of 2022, the Obstetrics and Gynecology Unit of Kavieng Provincial Hospital introduced the HPV screening. Unfortunately, we, however, had to stop this service the following year because of a number of reasons. Primarily because the service provider was located in Port Moresby, the National Capital District, and specimens had to be transferred across. Results were received 4 to 8 weeks after, and when results were available, we did not have the capacity nor the equipment to treat our positive clients. And so at that time, the focus shifted towards working towards establishing an elimination of cervical cancer program in the PHA, and the establishing the HPV screen and treat service for our women in the community. Very early on, we knew that this was a fairly new program. Not all of the PHAs in the country has established this program, and we knew that we had to start from somewhere. So advocacy was the main way forward, to engage the community, to understand the burden of disease in our community and the need to do something about it. And we recognized that the biggest impact would be from establishing a program in the PHA, and the first part of that program would be the point of care HPV screen and treat service. So in the first picture up on your left, that is the first ever meeting that we held with the female staff of Madang Provincial Hospital in March of 2022. We had in that audience a few male champions as well. And this was the first advocacy that we did. And in that audience and that meeting, the fundraising committee was established and formed, and discussions and planning for the first major fundraising exercise and advocacy exercise to take place. And that would be the walkathon and wheelbarrow push that we did in June of that year. And you can see photos of that event. So we utilized all the media platforms that we had available. We went on social media. We used the local radio on National Broadcasting Commission radio to give interviews. And we also wrote letters to individuals, private organizations, business houses, both within and outside of the province, to garner support towards our fundraising drive to set up this program. And we were really overwhelmed by the support that we received. It was positive from the community. And our first fundraising activity started in June of that year. And by October of the same year, we had already raised 55,000 kina. And for us, that showed the big support that the community had, the interest in improving maternal and women's health in the province, and that community engagement and participation also involved and spread across quite a number of communities within the province. We have 2 districts in the province, and advocacy activities took place in both districts. And in most of the audience that we spoke to, there was 1 or 2 individuals in that audience who had experienced or knew of a woman who had either succumbed to the disease or was suffering from disease. And they realized and recognized that the burden was huge in our community, and we needed to do something about it. Also, coming from a public health point of view, and with the limited budgets that we have, we knew that this was an impact service and strategy, which would really, really help our women, given that the cancer services in this country is lacking in some aspects, and we do not offer a comprehensive care for our cancer patients in this country. So these were some of the things that really drove this drive to get the program up and running. So very early on, we recognized the main challenges, and I think the challenges outlined in this screen would be the same for other public PHAs, provincial health authorities intending or considering setting up this program in their own organizations. And the main challenge, the first was the equipment and consumables. Of course, we needed that. We didn't know how we would get those, but we were positive all throughout. We needed a space to set up the clinic, human resource staffing, because this was a new program, human resource training, development, and capacity building. Papua New Guinea, we do not have a registered cancer data registry, and that was a need. We recognized the funding budget that we required, and also we recognized the lack of leadership and coordination from the National Department of Health level. For cervical cancer, this is a program under the Public Health Directorate, and for all the other programs under the Public Health Division, the structures are in place. But for cervical cancer, which is fairly new, we do not have a top-down sort of structure, and there is interest locally, and the program is being established locally, but not really in a good top-down structure. So that was another challenge for us. So partnerships was the answer to our prayers. Through partnerships, we were able to address all of those challenges, and through the community engagement and advocacy exercise that we did, we managed to be connected and get connected with Professor Andrew Valeli of Kirby Institute, who later introduced me to Vanessa of ECCWP, and Rachel and the rest of the team at Kirby. And through that partnership, they were able to secure funding for our program through EPIC. And they were able to connect us with the Western Highlands Provincial Health Authority, who basically assisted us to deliver our training and staff development for our new staff. And we were grateful as well to our CEO and his management for the Partnerships Committee. And through that platform, we were able to approach the Catholic Church Health Services of New Island Province to ask if they could assist us with space in their clinic to set up this program. So basically, the funding grant is a 4-year DFAT grant, which was awarded in November 2023. And the target is to screen 20,000 women. Papua New Guinea, New Island Province has a population of about 230,000, depending on which data you would like to look at. And out of that, 48,000 are women within the reproductive age. And so our target population to screen is 20,000 women within the eligibility ages of 30 to 59 years of age. And the funding would cover staffing, extra staff needed for the outreach activities, community engagements, consumables, HPV cartridges, the Gene Expert machine, workshop and training, outreach costs, and communication. The New Island Provincial Health Authority, in its agreement, contract, a partnership agreement with the partners, caters for 4 program staff. It catered for the refurbishment of the Stella Maris Clinic and covered the costs for the first cervical cancer screening clinical training workshop, and also covers for the ongoing operational costs for the clinic. The Catholic Church Health Services in New Island Province provided us the space in the Stella Maris Voluntary Counseling and Testing Clinic for HIV. This clinic is located in Kavieng Town, in the middle of Kavieng Compound, and has been given to us free of charge, and that we are really, truly grateful for. So the implementation process for this service began with, of course, the advocacy and fundraising drive, planning, and then the partnerships and some more planning. And then in August of 2023, our CanScreen was set up. This was followed by the clinic build and set up in November of the same year. The first ever human resource training, clinical training for our staff took place in February of 2023. And 2024, and screening commenced on the 1st of March 2024. So it was a very joyous occasion at the launching and opening of the Cervical Cancer Screening Clinic and Cervical Cancer Elimination Program, which for New Island Province, which took place on the 1st of March last year, which we had all our major stakeholders, major sponsors, major partners. From Kirby, we had Professor Valerie and Rachel and Lisa, DFAT, our DFAT representative, and the New Island Provincial government and all the community representatives were part and partial and present at that day. So since the 1st of March 2024, we've screened a total of 3,100 women. HPV positive rate is about 21%. But we have not reached 100% of thermal ablative treatment for all our positive women. So the next steps forward. Last week, we received our contract, which our CEO has signed for our funding. And so that our first payments for the funding support should come in by this month. And then we will begin the recruitment and training of our additional staff needed for the outreach exercise. We will then proceed on to the community engagement and mobilization and plan and carry out our outreach programs. And we also intend to introduce vaccination in the 3rd year of this program, which would be next year once our funding is available. So a little bit on the EPIC aid grant. The Elimination Partnership in the Indo-Pacific for Cervical Cancer is a 12.5 million Australian dollar regional and aid grant from the Australian government. And the EPIC is a consortium comprises of the Daffodil Centre, which is a joint venture between the University of Sydney and Cancer Council New South Wales, the Kirby Institute, the Australian Centre of the Prevention of Cervical Cancer, Family Planning Australia, Unit Aid, and the National Centre for Immunisation Research and Surveillance. EPIC will also support cervical cancer elimination in the Indo-Pacific region, including New Island Province, PNG, Solomon Islands, Timor-Leste, and Malaysia. So this is good news for our other sister PHAs within the country, seriously considering starting this program in your organizations. To conclude, the first phase of the Elimination of Cervical Cancer program, which is the point of care HPV screen and treat service, has been accomplished. We embark on the second phase, which is the rollout of the Rural Patrol outreach programs, which will be followed by the third phase, which is the introduction of HPV vaccination once we have funding. And government funding is a major need with leadership from the Papua New Guinea Department of Health. So I'd like to take this time to acknowledge this wonderful, wonderful, brilliant group of people who all collectively contributed to the successful establishment of this program. And I am just a representative of this big group of people. And I would like to acknowledge my CEO and his executive management team, the New Island Provincial Health Authority staff and greater New Island community, stakeholders, partners, the Kirby Institute, the ECCWP program, Ms. Vanessa Price, our program manager, Teresa, EPIC, DFAT, the Western Highlands Provincial Health Authority team, our Catholic Church Health Services, and our clinic staff. So that brings me to the end of my presentation and talk. I'd like to thank you all for your attention. And like my colleague Margaret has said, happy International Women's Day. Thank you.
Thank you so much, Dr. Paula. And it is truly remarkable what you've already managed to achieve. And as you said, before you've even received formal funding. So well done to you and the team. And last, we have Dr. Nanisi Sakiti, who is a consultant obstetrician and gynecologist in Lautoka Hospital, Fiji. Nanise holds a Bachelor of Medicine and Bachelor of Surgery and a Master's degree in Medicine in Obstetrics and Gynecology. Additionally, she has completed a fellowship in gynecologic oncology through the International Gynecologic Cancer Society, specialising in gynecologic cancer care. Dr. Nanise is a board member of the Pacific Society of Reproductive Health and an associate member of the Australian Society of Gynecological Oncology. Extremely passionate about women's health, she is dedicated to advancing services in Fiji and the Pacific. Her vision is to see the elimination of cervical cancer in the region, an entirely preventable disease that continues to burden Pacific Island nations. Dr. Nani, over to you.
Nimbula Vinaka, thank you very much for the introduction, and thank you to the Kirby Institute for the invitation to be part of the International Women's Day and HPV Awareness Day. As we celebrate the strength and resilience of women globally, it is important to acknowledge one of the greatest health threats to women in the Pacific, and that is cervical cancer. This afternoon, I will be presenting on cervical cancer in Fiji, its challenges, and the path Fiji has taken to elimination. In Fiji, cervical cancer is the second highest cancer. In 2022, the International Agency for Research on Cancer through the Global Cancer Observatory reported that 136 women were diagnosed. This burden is high in 20 to 69 years, with a mortality rate of 49.7 per 100,000, in which it places Fiji among the countries with the highest cervical cancer incidence. From 2004 to 2006, 56% mortality rate were reflected in cases with cervical cancer, and in another study, this 56% could be as high as 90%. And this shows that our Fijian women presents very late with this disease. Our screening coverage is far below the WHO recommended target for effective prevention. One of the local studies by Ms. Kunatonga suggests some progress with a 35.1% of coverage. Though it is still not sufficient to achieve elimination, hence the need to increase the screening uptake. To understand why this remains a critical issue, let's look at some of the reality of what Fijian women with cervical cancer faces. One is late presentation. Majority of our women diagnosed with cervical cancer are diagnosed at later stage of disease like stage 3 or stage 4. They come in with symptoms of heavy bleeding, pain, and weight loss. As a gynecologist, we know that once you present with symptoms of cervical cancer, it's most likely you have a bulky disease, and most of them in Fiji have advanced stage. There's also limited public awareness of early signs and screening benefits. Another reality is barrier to screening. One of the barriers to screening is geographical challenges. Fiji is made up of 300 islands. It can be difficult to reach the remote islands in Fiji. We also have some villages in the interior of the two main islands. There are fears among Fijian women. There are misconceptions. There are cultural beliefs that cervical cancer or cancer is due to a separate entity apart from HPV cause, which prevents these women from seeking care. HPV test is a gold standard recommended test that is recommended by the WHO. Unfortunately, it's not widely available. Another challenge is accessing treatment. And no local radiotherapy, and accessing treatment is an expensive process. We do have limited surgical capacity, especially in radical hysterectomy. A reality of cervical cancer in Fiji is also psychosocial and economic toll on women who are actually primary caregivers. This illness affects the whole entire family. The treatment costs, the loss of income, and the travel expenses is a burden. And unfortunately, Fiji doesn't have a proper palliative care program. What has Fiji done in terms of cervical cancer elimination given its challenges? The WHO has set elimination goals to eliminate cervical cancer as a public health burden by setting its target known as the 90-70-90. In 2019, Pacific Island Group gathered in Suva to talk about this elimination goal and tailor it to our resources and our limitation. Fiji is in line with what the Pacific Island has decided, and that is to ensure that 90% of our girls are able to have vaccination, HPV vaccination by the age of 15. 70% of our women have HPV testing from 35 to 39 and also a repeat 10 years later. And 90% of our women who have pre-malignant lesion and cervical cancer is able to access effective treatment. In terms of vaccination, our vaccination program for HPV has been incorporated into the school-based program. There is discussion and also assurance that to strengthen the existing immunization program. Currently, there's drafting of the immunization policy and its endorsement, and Fiji has transitioned to one-dose vaccination. In terms of screening, we've adopted the HPV screen and treat WHO recommended, which we had piloted last year. We've looked at the algorithm and we've tweaked it to how Fiji is going to be able to use it. And now we have planned for it to be rolled out this year. In this program, the aim is to train healthcare providers, expand access to screening by increasing awareness and outreaches. With regards to treatment, there has been increased number of visitation from the Pacific Alliance Gyno-Oncology Group to upskill our local gynecologists on surgical treatment, also to help us in decision-making on patient management. In the International Gynecology Society Fellowship Program that had been started, in which Fiji had joined in 2018, has been continued, and we had ensured that it is strengthened so that we can have a lot of gynecology to look after cancer cases. Also, there's effort to establish local radiation therapy to reduce the need for overseas treatment. Recently, there was a development of the Peter Mac project, which physically started last year, in which there's an agreement between Peter MacCallum Centre in Melbourne, the Ministry of Health Fiji, and also the Fiji Cancer Society to allow 5 women to access radiation treatment per year. And at the moment, we are going to send our 5th patient. In terms of palliative care services, we're planning to establish palliative care services to improve the quality of life for terminally ill, continue to support training in palliative care that has been ongoing or done by the Fiji Cancer Society, and also discussion on infrastructure. Lastly, with regards to policy, we had revised the 2015 cervical cancer screening policy, and now we had developed the elimination policy with 2 working documents. At the moment, we are at the end stage of this drafting process, and hopefully we hope to get it endorsed soon. This process has been done with guidance and help from our international partners, such as the Kirby Institute, the University of New South Wales, and the Australian Centre for Prevention for Cervical Cancer. Recently, we've had our National Cervical Cancer Policy Consultation meeting with all our subdivision and divisional health, and also our non-governmental organization, which happened last month. With challenges remain, Fiji is on the right path to eliminate this preventable disease. For the first time, we now have the tools to eliminate. We are committed through vaccination, screening, and timely treatment, hence can prevent unnecessary death and give Fijian women the future they deserve. Elimination requires community engagement, strong policies, and global collaboration. Fiji will need to continue investment into screening and treatment to ensure this vision is a reality. I urge everyone who's listening here today to stand with us in this fight. Together, we can ensure that no Fijian or Pacific women dies from this preventable cancer. Thank you, and Vinaka Bakalim.
Thank you so much, Dr. Nani. I'd like to invite all of our speakers now to put on their cameras and their microphones so we can begin the Q&A session. And I'd like to remind the audience that the Q&A button down the bottom is where you can enter your questions, and we'll try to get as many of those as possible. So the first question is for Jossie, and it's from Dora and Yvonne. And they're asking, how do you let the women know in the Highlands about the outreach clinics? How do you get the word out to the women in the communities? Jossie?
Thank you, Vanessa, and thank you, Dora, for your questions. Before we conduct our outreach activities, we do our awareness 2 or 1 week prior to the actual outreach date, which we do awareness at our local radio station. This is NBC Western Highlands. We disseminate letters to pastors to various denominations in the rural area. We put up notices at trade stores in the district, and we engage our district health promotion officers and village health assistants to go out and do general awareness.
Thanks so much, Jossie. And I know a similar process is carried out in Vanuatu, Margaret, with the forward team going out prior to outreach. I did want to ask you, Margaret, particularly as you are on outreach at the moment, could you tell us a little bit more about how the Vanuatu ONG team actually takes treatment to the communities of Vanuatu as well as screening?
Thank you, Vanessa, for the question. We have a schedule in place, an annual schedule for outreaches with regards to HPV. We plan for each provinces at the time, and for Vanuatu, I think we have 2 provinces yet to do the screening, although we have not reached the coverage or eligible women in the other provinces. But that's what our team is working on, to do a revisit to other provinces and see those ones that we have not screened to be screened. With the screening team, as we go province by province, we do have midwives. So it's a midwife-led screening team. So they do screening, they do testing and treatment as well. Thermal ablation is all done by midwives. And the doctors only follow the team when there are patients for tissue biopsy or LEDs treatment. So we have to take our LEDs machine with us out to the rural areas to do LEDs procedure for those women who need it, especially the ones who have been positive, been treated with thermal ablation, and then 6 to 12 months later they're persistently positive. They're also the ones that are being referred for LEDs. So that's how we doctors involved ourselves in the outreach. And not only doing the LEDs procedures, but we also do gynae consultations as well. We do, antenatal clinics, SRH, everything, because women are there when they hear about the awarenesses that the team is coming. So, they come in with all sorts of complaints, and they probably only see a doctor once a year. So, yeah, we have to be ready to do the consultations, do everything, basically, yeah.
Thanks, Margaret. It is amazing that the team is able to do that and try to meet those needs. Thank you so much. And we understand that you may need to go because you need to get back to the outreach that you're doing. So thank you so much for your participation, and happy International Women's Day, and please pass that on to the rest of the team as well. So we have a question from Rachel Sanford, who works for Family Planning Australia, and I might pose this one to Paula. For those women who decline treatment, do they say why, or why do you think that women that the treatment rate may be lower for women?
Thank you, Rachel. So like I said in my presentation, this is a new service. And I don't think women really know what happens in screening. And I think most of the education is done at the clinic before they get screened. And once the results are ready and they receive the results, we are experiencing some women asking us if they could delay their treatment to go home and talk to the husband and to get the husband's opinion or husband's approval before they undergo treatment. Basically, this is after they realize that they will abstain from certain activities for the next 6 weeks after undergoing treatment. And so we have experienced that women are going and they're not coming back. We have reached out to them. We have done an exercise where we've gone out to the community to try and follow up on this lost to follow up clients. Some of them are well educated, some of them are even health workers. And so it is interesting. At this point of time, we do not really know or understand most of the factors that contribute to that decision-making process of why they're not coming back to get the results or why they're not coming back for treatment. So it's a good area for us to investigate further and further find out these factors, and then we can be able to address them in our counseling. So I think one of the issues as well, or challenges that we also found out, was that not most of our villages have adequate toilet and ambulatory toilets for the villages, and our people tend to use the rivers and the sea most often. So that has also been one of the challenges to accepting and receiving treatment.
Thanks, Dr. Paula. This next question was for Margaret, but I know she has gone offline, so I might actually ask this one to Jossie, being the master trainer that you are. This question is, what capacity building training did you provide to staff? And did any of these staff come from a non-clinical role? For example, admin staff within the clinic now supporting HPV testing. So that could be, I guess, either the data entry roles, Jossie, or the community health workers and their role within the service. Could you comment on that?
Yes, thank you, Vanessa. We've trained testing officers, CHWs, and I think in Western Highlands, medical ONG registrar. And we do, we delegate tasks, we do daily task delegation. So a whole lot of them have the chance to do everything in the clinic, like triaging, to see if the woman meets the non-eligibility or eligibility criteria, health education, screening, using the gene expert machine, and thermal ablation treatment. For the data entry clerks, they were trained by the ACPCC by using the CAM screen. And I also involve them to do follow-up as well and assist in typing up notices for outreach notices and creating charts and creating the registration number for the clinic. They also assist, the data entry clerks also assist in do follow-up for the leads patient. I also trained the other one on how to pack the specimens, those liquid-based cyto specimens, which were sent down to Australia last month. So yeah, I involved everyone to be train them to be part and parcel of the cervical cancer screening team.
You certainly do have a well-oiled machine there in Western Highlands Province, Jossie, given I think in the data that you put up during one quarter, you screened over 3,600 women in a quarter, which is amazing. Thanks for that, Jossie.
Yeah, the data entry clerks.
Oh, sorry.
The data entry clerks were also sent out with the outreach team to collect the data at the rural areas using the tablets, and they make it easy for me to come up with my outreach reports and the clinic reports as well. Yeah.
Thanks, Jossie. And that's just highlighting the use of CAMScreen, which is a electronic registry program that all of the sites are using to both manage patients and also collect programmatic data that can be used for programmatic decision making. Dr. Nani, can I ask you, you're more at the beginning of the transition to HPV-based screening, and as you said, looking to reach that 70% target for Fiji. What do you think will be the key drivers for women to come forward for screening in Fiji?
Thank you for the question, Vanessa. I hope you can hear me well. My voice. I apologize for my voice. One of the key driving that we are currently working on together with our plan for rollout and also with the package for our program, we are also working on a communication, how we're going to ensure that awareness is put out there. So the team is also working on that. If you look at if you had recalled my presentation, I had mentioned that one of the barriers to reduce in screening in Fiji is that most of our Fijian women are not really aware of the symptoms, the sign, what is it for. There had been two previous studies done locally on this aspect of screening in cervical cancer, and it's quite obvious that most of the women in these studies were not even aware of what pap smears were for, what are the signs and symptoms that they were. So before we actually roll out a program, Fiji is yet to roll out the program. We've just finished our pilot. We're also at the end stage of our drafting. And we're hoping that in the middle of this year, we can start with the northern side of Fiji and roll out the program. So on Friday, in 2 days' time, we're going to be having a meeting with the stakeholders in the Northern Division to plan our move. And prior to that, we are actually looking at our awareness program as well. So that's going to be the main key factor in which we're going to put it everywhere, the social media, pamphlets, and all those things that we use. Yep. Thank you.
Thank you, Dr. Nani. Apologies for making you talk. That voice sounds quite sore, but thank you. I might ask this one to Jossie. So we've had some questions around the vaccination programs in Papua New Guinea and Vanuatu, and we have put some answers in terms of statistics for those in the question and answer section. So please have a look there if you would like to see that. But Jossie, could you comment on, there's a question around the acceptance rate of HPV vaccine for girls in Papua New Guinea. And I know you can only comment on Western Highlands Province at the moment, but has the screening program had any impact on the way that the vaccine has been accepted?
Yes, Vanessa, I think it has. The screening program is very much impact for the HPV vaccine program. Before the implementation of the HPV vaccine program, our team, through the outreach program, we went out and do awareness on the HPV vaccine, telling them that it's important for the girls to be vaccinated by the HPV vaccine, so to prevent them from cancer in the later in the later stage in life. So that has been done for almost 2 years before the implementation of the HPV program in late August last year. So our team, HPV vaccination team, have done marvelous work in doing awareness as well to the church group, the women group in the province, the teachers, the communities, and the parents of the those girls between age 9 to 14 years of age. They've, I think, conduct health information sessions to the healthcare workers in the province as well, to the district and the hospital, the security guards, the hygiene staff, the admin staff, and all this. So it is really a great job which our HPV vaccine team has done last year until now. So they started roll out the HPV vaccine program last year, August, and they've vaccinated around 8,647 girls so far in Again Central District. So they were planning to go to Tambul Nebele District, which is south of Again Central, but unfortunately, the person coordinating the program is hospitalized for almost 3 weeks now. So they have been doing mopping up in the Again Central area. Yeah. So they've overcome some challenges and some myths about COVID vaccine, and some parents were kind of thinking that the HPV vaccine could affect fertility, and also. So our team has done a great job by doing a lot of awareness, which convinced parents to allow their girls between the age 9 to 14 years to be vaccinated. And even the girls, they also come to the clinic voluntarily to get to be vaccinated by the HPV vaccine. So it's really a great job done by our team, Vanessa.
Thanks, Jossie. I agree. The amount of community engagement that's been done by both the vaccine team and supported by the screening team has been amazing, and they were quite worried about the hesitancy, particularly following COVID, but have had quite positive reception across the communities so far, which is fantastic.
We had tried to integrate the integration in urban areas like Again Central District. It didn't work out for us, especially those schools in the Mount Again Central. But in the rural areas in Tambul Nebele District, I think we just did one integration where the team and I went out, and me and the health promotion went to meet with the head teacher plus the other teachers to allocate day and time for our HPV vaccine team to go and vaccinate the girls. And I think they vaccinate about 90 girls that day. That was in the second week of February this year.
Thanks, Jossie. And Dr. Paula, I wanted to come across to you. I had been aware of the community fundraising that you had carried out prior to the program, and it was really interesting to hear more about it today. I wanted to ask you, what were the motivations behind that? What really motivated you to start that community fundraising towards a program for cervical screening?
Thank you, Vanessa. Cancer hits close to home. So we've suffered losses in our family from cancer. And working in an environment where we have, as Dr. Nani has shared, most of our women come in the later stages of disease, and there's pretty much nothing we can do about it. It really had a big impact on me as not only a clinician, but a woman, to try and do something in my capacity to help my community. And I think that was the big driving force together to get this program up and running. And then this was enabled by the immense support from our staff and the community to really see this drive and successful completion and delivery of the service.
Thank you, Dr. Paula. It's a story that I've heard repeated across the Pacific, and I can see the emotion is so close to the surface there, but thank you so much for sharing. I want to thank all of our speakers today for their time and for joining us here on International Women's Day. It has been a fantastic presentation from all of you, and the work that you're doing and the dedication that all of you show is truly humbling, and it's a real privilege to get to work with you. I'd like to thank the audience for your questions, and if you've got any further questions, please feel free to get in contact. But we will conclude the webinar there today, and with a huge thank you to our speakers and a happy International Women's Day to everyone. Thank you.